All right. Happy Thursday and happy opening day to those that celebrate. Thank you for joining our first fall prevention webinar of the year. My name is Isabel Davis, and I'm a health information specialist with Aging and Independent Services. In my role at the county, I coordinate fall prevention efforts, which includes leading the Fall Prevention Task Force. Before we get started, I would like to note that we will have a short Q&A at the end of today's presentation. So please save your questions for that time or type them into the chat. I'm now going to introduce our speaker, Dr. Kim Bell. Dr. Bell is a doctor of physical therapy and the founder of Vertigo Detective with over 20 years of clinical experience treating dizziness, vertigo, and balance disorders. She is dedicated to improving awareness among both healthcare providers and the public about appropriate care for individuals living with undiagnosed or unrecognized inner ear disorders. Dr. Bell has been a clinical leader on the San Diego Fall Prevention Task Force for the past 20 years, promoting evidence-based practice and advocating for vestibular assessments for older adults experiencing chronic falls. I'm going to go ahead and turn on over to Dr. Bell.
Thank you, Isabel. Thank you for that great introduction. I just want to welcome everyone to the Q1, the first quarter webinar for 2026 for the San Diego County Fall Prevention Task Force. I also want to extend an invitation for you all to become part of our task force if you're interested. We're a group of private business people and healthcare providers in San Diego with a passion for preventing falls in older adults. And we've partnered with the San Diego County Department of Aging and Independent Services to really work together as a task force to benefit all the older adults in our county. So we would love for you all to become involved if you're interested. Today, our focus is on new concepts of BPPV to empower your health advocacy. So let's get into this. We have 3 learning objectives today. First of all, we're going to understand classic benign paroxysmal positional vertigo, that is short BPPV for short, and how treatment works. We're also going to discover 2 emerging BPPV variants that are often overlooked in older adults. So this is where the advocacy part starts to come in play. And then we're going to learn how to advocate for yourself within the healthcare system to get assessed for BPPV and its variants. In order to have this conversation today, we're going to learn some new terminology in a particular field. And this particular field is called vestibular healthcare. Vestibular means your inner ear. This is your balance system, and it gives you equilibrium when you're sitting up, lying down, walking, and it helps to prevent falling when it's working well. So we're going to learn some new words that are in the field of vestibular medicine today, and that this will help us with our discussion. The first new word is the BPPV. That's the benign paroxysmal positional vertigo that I mentioned. In accordance with our first learning objective, we'll discuss what classic BPPV looks like, what are the indicators of it, how does it work within the anatomy and physiology of the inner ear, which is the vestibular system, is the inner ear. And then we'll take a look at why this is commonly missed in older adults with chronic balance problems, falls, and even near falls. So they almost fell, but they didn't quite fall, but it was kind of a scary incident. We still want to bring our attention to that because that is an indication this person may be at risk of falling in the future. So again, today's webinar is to advocate for people that are older adults with chronic balance problems, falls, and near falls. That's what we're going to look at. So to learn about this, let's talk about classic BPPV. The 2 key indicators, this is what your primary care doctor is looking for, or if you see a physician assistant or a nurse practitioner, or if you even see a specialist, such as an ear, nose, and throat doctor or a neurologist. This is what traditionally trained healthcare providers are looking for to decide if they think you have BPPV. They're looking for a complaint of spinning in certain positions. So the patient would tell their healthcare provider, I feel like I'm spinning in certain positions. It's usually brief and strong, and then it dissipates. And the clinician, that's the healthcare provider, we're going to call them clinicians, they would observe nystagmus when the patient is tested for BPPV. And nystagmus means involuntary eye movement. Some people call it nystagmus, some people call it nystagmus. And it basically means the eyes are jerking around or bouncing around or jittering, and it's involuntary. So it's involuntary jittering of the eyes is what the clinician is looking for during BPPV testing. And if these two criteria are not met, then the patient will typically not be diagnosed with BPPV in traditional healthcare. So let's look at the anatomy. What the BPPV is, benign means it's not a disease or anything. Paroxysmal means the symptoms come and go. So when you move into certain positions, you feel a brief, intense or mild even dizziness or vertigo spell, and then it usually dissipates within a minute. And it's in these certain positions that it occurs. And so that's why it's called benign paroxysmal positional vertigo, BPPV. And what causes this in the ear is that you can see on the screen here, there's an organ called the utricle. And if you look all the way on the right side of the screen, you see a little line pointing to a little orange egg there. That's called the utricle. That's an organ in the inner ear where the crystals are supposed to be. And they are there from the time you are formed in the womb till the end of the lifespan. And that's where they're supposed to be. And they have a job to sense speeding up and slowing down in a car or a train. But they can get loose, and then they can move through this set of canals that are half circles, and they can cause vertigo. So why do we care about this? Because it also affects balance, and it can contribute to falls. So let's look at, you can see the black dots in these canals show you that the crystals are in this area. So they've moved from the utricle into the canal where they're not supposed to be. And that's what causes the condition called BPPV. They've become dislodged, and now they're displaced. And that's what causes the brief, mild or intense spinning or dizziness feeling in certain positions. They can be anywhere within this labyrinth of canals that you see, okay? And that's called BPPV. So now let's talk about how treatment works. This is my grandpa, by the way. He was my model for a lot of training pictures I've taken. So he's demonstrating for us the classic test for BPPV. It's called the Dix-Hallpike test. And so this is where the patient would lie down, turn their head slightly to the right, and then lie back. It kind of looks like going to the dentist, right? So for people who have this condition, even if they don't know they have it, they've never been diagnosed, when they go to the dentist, if they have a feeling of spinning when they lie back and turn their head to the side for dental work, it's possible they might have this BPPV that's undiagnosed. Because remember, you'll feel the burst of mild to intense dizziness or vertigo in certain positions only, okay? So, and again, we're talking about classic BPPV. Of course, there's exceptions to every rule, but for today, we're gonna focus on the classic presentation. So in this case, this is the test. And if the patient has BPPV, they're going to feel a burst of dizziness or vertigo here for about a minute or less than a minute. And the clinician is going to see their eyes jitter around during this test. Okay. And then the clinician will treat them for BPPV by moving them through a sequence of maneuvers, something like this. And like for my grandpa, we'll roll him over like this and pause here for about 30 seconds to a minute as the crystals are falling through the ear canal, being pulled by the force of gravity into a new position, okay? So gravity is pulling the crystals down, and we've positioned the head in a way that the gravity is guiding the crystals back to the utricle, okay? So this is called particle repositioning maneuvers. Or you could call it crystal repositioning maneuvers. And these are designed to move the crystals back to the utricle, and then that BPPV is resolved. Okay, now, and you see Grandpa sat up, and now he feels better. Okay, so that's how the treatment works. And if it's done correctly, it works. It's one of the most valuable treatments available in healthcare today because it can work very quickly, and it can give people a lot of relief. So what we find here is once we treat the BPPV successfully, then the patient stands up and they go, oh my gosh, I feel so much more sturdy. My legs feel more stable. I can move around and I don't feel scared or afraid of falling because this problem in their inner ear is now resolved. Okay, so the treatment, if it's done correctly, can work very well. Some people need a couple treatments. Some people need multiple canals treated or multiple ears treated. Maybe they have it on the right ear and the left ear. But if it's treated correctly, it should show significant improvements after even only one treatment. And that translates to feeling more stable on your feet and being less of a risk of falling. So we're going to go through 3 scenarios about why this is missed in older adults. Why is this missed in older adults with balance problems and falls? I'm going to give you 3 scenarios today of why this happens and how to advocate for yourself if you think you fit one of these scenarios. So let's revisit the key indicators of classic BPPV. I'm going to give you a moment just to look that over again and remind yourself of what we said. So if you have BPPV, why wouldn't you complain of spinning? If that's a key indicator of BPPV that you're telling the doctor you're spinning and you have BPPV, why wouldn't you be telling this to your doctor? Why wouldn't you complain about spinning if you have BPPV? Well, remember, it's spinning in certain positions. And remember what I showed you about how we test for that with that Dix-Hallpike test. We lie you way back like you're going to the dentist. But what if the older adult is sleeping propped up like this? You know, a lot of people sleep propped up because of reflux or because of sinus problems or just because they feel more comfortable if they have heart or lung problems. As they get older, it starts to be more and more common for people to sleep propped up. So then they're not going into the position that would cause the spinning. So they're not going to complain of spinning because they're never lying flat or rolling over or moving into these certain specific positions that tend to trigger a spinning feeling. And look at this. Even if they're doing everything right, they're staying active, they're exercising, it can still go unidentified because, again, look at all these activities. They're all upright. Okay, so when would you feel the BPPV? Well, a lot of people feel it if they go to an exercise class that causes them to lie down on a mat on the floor. So anyone that's going to lie on a mat on the floor or roll over on their side on an exercise mat on the floor or lie down on a weight bench, such as to do a chest press, those are the exercises that are going to trigger the spinning. But if the older adult is only exercising vertical, like all these activities you see, then again, and they're sleeping propped up, then here's how the conversation is going to go. This is what I typically find with this population. I say, hi, we're working together for your balance. I'm going to test you for BPPV and see if you have it. And they say, no, I don't have any dizziness. I don't have any vertigo. And I said, okay, well, I'm still going to test you because I test everybody with balance problems to see if they have BPPV. I'm going to lie you back and turn your head to the side. And they go, oh, no, don't do that. If you do that, I'm going to get really dizzy. Okay, so this is a person who's never going in the positions that cause the symptoms, so they're not complaining of spinning. So if we do put them in the test position like this, they're going to have a mild to intense burst of dizziness or vertigo, and they will have the nystagmus that the clinician can see. But this goes unfound in older adults because they're not complaining of spinning, and therefore their doctor never refers them for testing. Now, let's look at the second reason why this can be missed in older adults. Again, we're going to ask the same question. If you have BPPV, why wouldn't you complain of spinning? Well, we've looked at one reason, because you're not going into those positions. But what if you do lie down and roll over and you still don't feel spinning, but you feel really off balance all the time and you're having frequent unexplained falls? Well, this is one of the new concepts I want to teach you. This is called vestibular agnosia. Okay, this is one of the newer diagnoses that we're just starting to wrap our brains around as healthcare providers. And basically what this is someone whose brain is not able to perceive the spinning. Okay, so when we think about how our brain works, we get information from our feet, from our inner ears, from our neck, and from our eyes. And all of that information is processed in the brain to give us postural control, help us stand upright, help us balance, walk around, navigate obstacles. But what if the brain is not processing the information correctly? And that's another reason why in older adults, they might have BPPV, but they're not complaining of spinning because they can't feel it. Okay. So vestibular agnosia, this presentation is going to look like a person that feels really off balance. Their equilibrium feels off and they're falling. They, just, oh, I was gardening and I just fell over. Oh, I was riding my motorcycle and I just fell over. Sort of these unexplained falls. But when you interview them, they don't complain of spinning. They don't complain of dizziness. But if they get tested for BPPV, they would have that nystagmus in the test position. So if this is the test of someone with vestibular agnosia, they're not going to complain of dizziness. They're not going to complain of spinning, but I'm going to look at their eyes and see that they have the nystagmus. They have the jerking of the eyes in this position, and they can still get treated for BPPV, even though they don't feel it. And then when they stand up, their balance is going to be remarkably better. So because this is a new concept, I want to refer you to find more information on PubMed. You can go there and look up the term vestibular agnosia. And the research, I'll be honest with you, is very limited at this point, but you can certainly learn more. I also wrote a blog on this, so you can just Google the term vestibular agnosia, or you can look at PubMed to find actual medical articles, and then you can always learn more. The strategy with this, if you feel that you do have a chronic balance problem and unexplained falls or near falls without a reasonable explanation, then you can talk to your doctor and request BPPV testing. That's one strategy, okay, that you can use. So you want to say things to your doctor like, I want a root cause analysis for my balance problem. I want to figure out, why am I falling? Why do I feel so off balance? We really haven't come up with a good explanation. And I exercise and I'm strong and my muscles are good, but I still feel off. I still feel imbalanced. I still feel afraid of falling. I am still having near falls, or I am falling without explanation. And I want to work with you to figure out why. And that's the kind of approach you want to take with your doctor if you choose this strategy. And you can request a referral to a vestibular healthcare provider. Now, keep in mind, vestibular means the inner ear. So this could be a doctor, like a medical doctor. It could be a physician assistant, nurse practitioner, or it can be a physical therapist. Now, if your doctor is not familiar with vestibular healthcare, then you may help them by looking online for a provider. You can also, in some cases, go directly to a vestibular provider without a referral. So I recommend talk to your doctor about this, but also you can look into it yourself as well and look for vestibular providers. One thing about San Diego County that's wonderful is we have a lot of good providers embedded within each healthcare system. So it's kind of whatever your favorite healthcare system is in San Diego, you can find most likely a vestibular provider there to help you. So you can search for a vestibular provider, and many patients end up working with a vestibular physical therapist. So again, they have these at all the different hospitals in San Diego and many clinics all around. So you can find somebody to test you for BPPV. Now, if you do that, we're going to talk about why it can still be missed. And this goes on to our second key indicator of how BPPV is typically diagnosed in traditional healthcare. So let's look at this next. This is the next new concept we're going to learn to accomplish our second learning objective, which was 2 new concepts. We're going to learn our second new concept now. The first one was vestibular agnosia. And now we're going to move on to the second new concept. Again, why is BPPV missed in older adults? Let's review again the classic indicators. The patient usually complains of spinning in certain positions. If that's not happening, they will not even get referred for testing. And we talked about two scenarios where that can occur, both because they're not going in those certain positions or because they are spinning, but they can't feel it if they have vestibular agnosia. So we talked about one strategy being ask for a referral to BPPV testing if you feel chronic imbalance, falls, or near falls. Now we're going to look at if you do that and you do everything right, you could still go get tested and not get treated because if the next criteria is not met. If the clinician does not observe nystagmus during testing, they may just sit you back up and say, we're not going to do any treatment, even if you have BPPV. So let's look at why that can happen. Let's kind of brainstorm. Why wouldn't a clinician observe nystagmus during the BPPV testing? Well, this is the second new concept here. This is called type 2 BPPV. So type 2 BPPV, truthfully, I've been treating this since I first started doing this kind of work 20 years ago, but we used to call this subjective BPPV or symptomatic BPPV, meaning the patient is complaining of those bursts of dizziness or vertigo in certain positions, but they don't have any eye movement. There's no nystagmus that the clinician can see. Now the researchers have come out with a way to name it. Now we're calling it type 2 BPPV. BPPV with no nystagmus. And so what happens in these cases? This patient got BPPV testing done. That's great. And they felt dizzy or vertigo during the test. A burst of mild to intense dizziness or vertigo occurred in this testing position, but there was no eye movement. The clinician does not observe nystagmus because they have type 2 BPPV. So what happens? The patient feels extremely sick after the testing, nauseous, more off balance, dizzy, but they did not get any treatment because the nystagmus did not show up. The clinician just set them back up and said, I'm sorry, I can't help you. You can go on your way now. So I want to refer you to PubMed once again for a theoretical explanation of how this can happen. We're not going to get into that today, but this is for further resources. You can look up type 2 BPPV on PubMed. And because this is a new concept, you'll see that the information is very limited. But stay tuned. I'm sure more will be coming out about this because I see this all the time. I've seen this all the time frequently for like the last 20 years. It's very common. Okay, so what can you do if you go get tested for BPPV and you get dizziness, vertigo, or nausea during the test, but the clinician sits you back up and says, I'm not going to treat you because I didn't see any nystagmus? One strategy is to request for them to try to treat it and just say something like, it was actually really bad on my left side. I'm wondering if you can just try a treatment on me and let's see if it helps. And say, maybe I have type 2 BPPV. And that's a strategy you could use and then just see what happens. Maybe that'll be the breakthrough you need. So why is this important? Because look at this, a meta-analysis has revealed that several components of postural control, this postural control means your balance, your stability, your equilibrium, your ability to walk, your ability to prevent falling, responding when you lose your balance. All those things are all postural control, your alignment, the ability to stand upright against gravity, okay, and align your bones. So several components of postural control are affected by benign paroxysmal positional vertigo, meaning when you have this condition, it's affecting your postural control, it's affecting your balance, and they found these improve after the particle repositioning maneuvers. But the disconnect here is that even if the patient knows they have BPPV, they don't realize how much it's affecting their balance. Okay, so this is the key point I want to make, is if we treat the BPPV, the postural control improves. Therefore, the balance improves. The risk of falling is less. And of course, this only works if the patient has BPPV. But what I've found is a lot of people have it and they have no idea, and neither do their doctors. Okay, so here's the take-home point. If this is how you feel walking across a parking lot or your kitchen, then this is the risk that eventually, at some point, you could end up on the ground. it can start a downward spiral, and it can result in very expensive medical bills. So we're encouraging you to become an advocate, to speak up, to ask questions. Again, take that role of, we want a root cause analysis. We want to know why. We want to try some strategies to advocate for ourselves, to get answers and relief for our balance problems. And if you're not comfortable advocating for yourself, you can bring someone younger with you to your appointment who can ask the questions on your behalf. I would encourage you to think outside the box. Maybe this is the missing puzzle piece that's going to be the final thing that you need so that you can live a life like this. If you want to learn more from me, I have 3 UCSD Stein public lectures available on UCTV and also on YouTube on the topics of fall prevention and dizziness and vertigo. I want to thank you for attending the webinar today. And we have, I think, 3 minutes for questions, Isabel. So I'll turn it back over to you now, and you can let me know if you received any questions. And I want to thank you all for attending. It's been a real pleasure to share this information with you.
Yeah, thank you, Kim. All right, we did get a question in the chat. The question was, why does the temporary fix for BPPV choose lying on one's left side? Why not the right side?
Oh, yeah. That was just an example. So that was just an example of one treatment. And that was, so in that example, I was treating my grandpa's right ear, which is why he was facing to the right when he was lying down and then rolled over onto the left side. So it's because that was a demonstration of a maneuver for the right ear. Okay. But that's not necessarily the fix for everyone. That was just one example I picked in order to convey the information for you for this webinar.
And then the follow-up question to that would be, how do we know which ear is causing the problem?
That's a great question. And I would say, of course, there's exceptions to every rule. But the classic way is it's whichever side you feel more dizzy when you lie on, typically. So if you lie down, you roll to the right, you're more dizzy on the right. Classically, that's usually the right side. You roll to the left, you're more dizzy on the left. Classically, that's usually the left side. Or turning. So some people, like, you're turning in your kitchen because you're cooking. You're turning to the right to get the utensils out of the drawer. You're turning to the left to turn back to the stove. So it's usually the side that feels more wobbly when you turn towards it. But I will just caution you to say that you should not try to treat yourself or assess yourself. It really needs to be done by a professional who can observe your eyes, because the nystagmus is the key for diagnosis in classic cases, because there are 3 different canals in each ear, and there's different locations within each canal where the crystals can be. And all those require different treatment maneuvers. Okay. So it really does not, you do not want to go throw darts in the dark and just start treating yourself for vertigo, because you can make yourself worse. It really needs to be assessed by a professional, supervised by a professional from start to finish. And that's why I'm recommending the strategy to talk to your doctor and get a referral to a vestibular healthcare professional, whether that's a doctor, a physician's assistant, a nurse practitioner, or a specialist like an ear, nose, and throat doctor, a neurologist, or a physical therapist. Any of the above is okay, as long as they specialize in the vestibular system and that they can do the particle repositioning maneuvers. That's what you want to look for.
All right. Thank you all for joining us today. If you are interested in Kim's contact information, that is on this next slide that's coming up. I see that is a question in the chat. We recognize that we might not have been able to answer all of the questions during this session. So if you have any follow-up questions, please send them to the Healthier Living email address on the screen. And then we will be sharing an FAQ document in the coming weeks to address some of the common questions that we received today. Thank you so much, and have a great rest of your day, everyone.